Good afternoon, everyone, and welcome to another week of the Superior Health's COVID-19 Nursing Home Leadership Roundtable. It's great to see so many familiar names and faces back on the call, so thanks again for joining us. The session today is actually part one of our three-part series on immunization practices. And so Jerry Hineker and Kristen Bosch will be talking through some of that content for us. My name is Kelsey Ostergren, and as always, I'm joined by Jerry and Kim, my co-leads, as well as Elena, who will be facilitating our Q&A portion of the session. I do want to just sort of throw out another reminder, as we do at the beginning of each session, just to invite you to engage. The first half hour is always dedicated towards more didactic content and education, but the second half is really your opportunity to ask any questions, either about the content that Elena and Kristen and Jerry will be sharing, or if there's anything else that's on your mind, things you've struggled with. This is really just your opportunity to talk with your peers and see how they're doing things. So I just really encourage you to use the chat function throughout the session as well. We do read through the comments and questions that are posted there, and I know Elena will kind of keep an eye on that as we go through our session today. So the slides for our session are available. I will put a link to those in chat in just a moment. And as a reminder, at the end of the session as well, we do have an event evaluation form, which we welcome your feedback on. Just always, we want to be mindful that we're meeting your needs and expectations. And if we're not, we want to know so that we can do better. So we'll put that link in the chat a little bit later on in the presentation. But for now, I will turn it over to Kristen to kick us off for our presentation today.
All right, thank you. So our objectives for this presentation, we would like for you to appreciate why vaccines are important for those with chronic conditions such as diabetes and cardiovascular disease, gain techniques for residents and their families about vaccines to encourage vaccine acceptance, and understand the current vaccine recommendations for influenza, pneumococcal, and COVID-19. So we will begin talking about chronic conditions and why vaccines are important for those chronic conditions. So we have that chronic disease can make it harder for your immune system to fight those infections. You are at risk for more serious complications from an illness compared to people without that chronic disease. The immunization provides the best protection against vaccine preventable diseases. And it's one of the safest ways for you to protect your health, even if you are taking prescription medications. Additionally, vaccines protect you and your loved ones from many common and serious diseases, and the potential costs of getting the disease, including serious health effects, time loss, such as missing work or family events, and financial costs. And it can actually worsen a chronic condition if that individual contracts the disease. So some common infections in the nursing homes. Took a look at 2011 Aging Health article, Common Infections in Nursing Homes, a review of current issues and challenges presented by the NIH National Library of Medicine, found that infections in the nursing home population have been associated with high rates of morbidity and mortality, rehospitalization, extended hospital stay, and substantial healthcare expenses. Urinary tract, respiratory, and skin and soft tissue infections are the most common endemic infections among nursing home residents. And epidemic infections most commonly reported include gastroenteritis, influenza, and skin infections. Pneumonia and lower respiratory tract infections remain the leading cause of mortality in nursing home residents and a primary reason for resident transfer to a hospital. It has been reported that nursing home residents in the USA account for 10 to 18% of all people hospitalized for pneumonia, corresponding to an average hospital cost of approximately $10,000 per admission. Older adults usually have fewer typical signs and symptoms of influenza, making early diagnosis and prompt treatment difficult. As a result, it becomes prudent to annually immunize older adults and their healthcare workers against influenza. Several studies have shown a reduction in mortality of older adults if their healthcare workers have been immunized. Addressing some challenges to infection prevention, it is known that nursing home residents are at risk of infection because of frequent hospital stays, advanced age, exposure to multiple courses of antibiotics, and numerous comorbidities. Older adults also have a diminished immune response, including phenotypic and functional changes in T cells. Other factors include malnutrition, multiple comorbidities, and polypharmacy, with use of medication that may diminish host defenses. And in addition, older adults with cognitive impairment may not be compliant with personal hygiene and hand washing and may have functional impairment that leads to immobility and urinary and fecal incontinence, thereby increasing the risk of acquiring new infections and for transmission of those infections. So taking a look in pneumococcal risk for the unvaccinated, the vaccine and the risks of being unvaccinated. For those who get it, pneumococcal bacteremia kills 1 in 30 children and 1 in 8 adults, while pneumococcal meningitis kills 1 in 12 children and 1 in 6 adults. The CDC supports that being up to date with COVID-19 vaccine to provide protection against infection during the emergence of the Omicron variant, and adults were 5 times higher risk of infection when unvaccinated compared to those who were fully vaccinated and with a booster. In the 2019 and 20 flu season, the CDC estimated the flu caused 22,000 deaths, with nearly 52% of the US population 6 months of age and older getting a flu vaccine, preventing 6,300 deaths, which averages to 12 lives saved per day over a year. These graphs represent the comparison of cases on the left of COVID-19 to deaths on the right graph in those unvaccinated, with the solid line representing fully vaccinated with the longer dashes, fully vaccinated without the booster with the dots, and fully vaccinated with booster with the dash and dot. The colors representing the various variants of COVID-19, and our y-axis represents the events per 100,000, while the months are denoted on the x-axis. We can see that the unvaccinated populations have remained significantly higher than those who have some form of vaccination and protection, especially when we look at the incidence of deaths. And here, the top range of influenza burden estimates shown are from the severe 2017 and 18 flu season. As we know, flu viruses change constantly from season to season and sometimes within the season. Thus, the reason for changes made to the vaccines to keep up with those changes. Seasonal flu causes substantial sickness and death, with the US flu burden each year in 2010 and to 2020 resulting in 9.3 to 45 million illnesses, 140,000 to 810,000 severe cases or hospitalizations, and 12,000 to 61,000 deaths in those that were unvaccinated. And next, I'll hand it over to Jerry.
Thank you, Kristen. So now we've learned a little bit about why it is so important for the residents who have chronic conditions to get vaccinated against those conditions that there is a vaccine available for, such as influenza, pneumococcal, and of course, COVID. We're going to talk more a little bit now about what are some of the strategies that you can use to help your residents and their families who are maybe making the decisions for them get vaccinated. So again, we're talking about a number of different vaccines, not just the COVID-19 vaccine, but also influenza and pneumococcal. And so, you know, with COVID, we saw that, you know, there were some things happening and people were you know, turning down vaccinations, which has maybe now made it harder to even get people to take the influenza or pneumococcal vaccine. So here are some strategies we're going to talk about today. The staff recommendation, we'll go through each of these a little bit more, but motivational interviewing, vaccine standardization, medical reminders, using effective messaging and having this delivered by trusted messengers, using vaccine ambassadors, and then also how we can combat misinformation. So to start with, taking a look at that staff recommendations. So this remains one of the highest highest strategy to use, and is recommended by the Advisory Committee on Immunization Practices, because you'll find a lot of the residents and the families, the staff that they're interacting with on a daily basis, they trust what they're telling them, maybe even more than the medical community as a whole. So this is why, if you can work with your staff and have the staff work with the family and their residents. One of the recommendations, of course, is to make sure that you're talking with each resident and each family about vaccines and why they're important and why it is that you feel that the residents should get them, especially those with chronic conditions, which is probably the majority of your residents in your facilities. You can share some of the information that Kristen just went through, and so why vaccinating, and so if you get the flu and you have a chronic condition, it can make it so much worse. So I think sharing some of that background information is critical. Listen to them with empathy. So, there's a lot of information out there and a lot of misinformation out there. So you want to listen to what they're saying to you, and then acknowledge their concerns. When you're talking with them, ask open-ended questions. So why is it that they're resistant to getting the vaccine? And then when you're having your conversations with them, target that conversation towards, the concerns that they're bringing up, making it kind of that one-to-one or, resident-centered conversation, because different residents and their families are going to have different concerns. So again, listening about what their concerns are, and not just using a standard spiel with each resident, because different residents may have different concerns. Another strategy is motivational interviewing. And we've previously done sessions as part of these series of webinars. We've done sessions on motivational interviewing, so I'm not going to go as in depth because I'm not the expert that Mia is, but just want you to remember that motivational interviewing are they're resident-centered conversations, and they're designed to increase the residents' motivation and the likelihood of doing a certain health behavior. And we do have links to the different information on motivational interview at the end of, it's part of the slide deck, and Kelsey did put that link in chat. And so there's tip sheets in there, and we have recordings of the different sessions that we've done previously. Next, I want to talk some more about vaccine standardization. So when within your different facilities, look at how you can standardize how you are giving the COVID vaccine or the influenza or the pneumococcal vaccine. So what are the, put standing orders together for each of them so that you have that in place, and it makes it easier for people to know it's just exactly what the protocol or the process is for getting those vaccines. And maybe you've set up already, maybe you're doing flu clinics or for the flu vaccine. And so that would be part of that process. Also, look at how you can offer the vaccine as more of a default option. So I think a lot of times, we come in and we ask the questions like, oh, do you want to get a vaccine today? So instead, talking to the residents and their families about, okay, we have the flu vaccines, you can come, you can come and get it today. What time do you want to get your vaccine? So again, they still have the option to say no. It's not like, we're forcing it on them, but offering it more as a default versus like, oh, when do you want to do this kind of thing? And then just integrate the vaccination into everyday practice. So for those who maybe haven't gotten a vaccine yet or decided to get it, bringing it up as part of that practice, like maybe when if the family is making decisions for the resident, maybe when they come in to visit and say, hey, we see that, your mother hasn't had her flu vaccine yet. Can we talk to you more about it today? So just making it part of that everyday practice. Another thing you can do too is looking at those different ways to put those reminders out there about the different vaccines. You can post messages on the resident bulletin boards in their rooms, like if there's a flu vaccine clinic, as kind of reminder if it's somebody who's like, makes that own decision for themselves to get the vaccine, that it's on their bulletin board, that they can, know that it's today and they should go get their vaccine, or else to posting it on the community bulletin boards. And that again is to remind them about vaccinations that are available or why vaccinations are important, and about any vaccination clinics. And these are useful too for the family members to know about. You can also send messages out to the families, and you can do like auto-dialed phone calls, text messages, postcards, however that family has chosen to get the message for their family members. Other strategies to use are, the first one here is effective messaging, excuse me. And here what we want to do, so incorporate messages that have undergone specific testing within different communities to produce that desired outcome. So people, you want to use different messaging for different groups of people because people take in this information differently. So, or, they trust different people to hear the message from. So want to incorporate that messaging that has undergone the testing when you're using it. Also use trusted messengers. So these are people that are credible sources within specific communities or specific populations. Maybe you have one of the residents who all the other residents trust, and they're really about getting the flu vaccine. This is somebody that you can use to help spread the word about getting their flu vaccine. You can also, we'll talk a little bit about it, vaccine ambassadors. Trusted messengers can be trained to become vaccine ambassadors too. And again, vaccine ambassadors are community members. They're trained to disseminate important healthcare information. And in this case, it would be information about vaccines. So if you have that type of program within your facility, using vaccine ambassadors is another method that you can use. And then the last thing I want to talk about here is combating misinformation. So we know, there's always been misinformation out about vaccines. It's not, we probably just saw it more during COVID. And so when you want to combat misinformation, it's about addressing and dismantling the misinformation and disinformation. And here I shared the difference between the two. So misinformation is false. They're both false information, but misinformation is false information that is shared by people, but there's no really malicious intent. They're not purposely trying to mislead people. It's, we know how from the old game of telephone back in the day, somebody hears a message at the start and it's totally different by the end. So, misinformation can spread in that way very easily about vaccines. And again, it's not meant to mislead people. But disinformation, again, it's also false information, but it was deliberately created and disseminated with a malicious intent, and it's to manipulate the narrative about the vaccinations. So that you can use the same tactics for both of these, for both mis and disinformation, and that's fact checking. So having the facts about vaccines available to you when you're talking. So this goes back to our first, bullet point where we're talking about, talking with the residents and their families. So if you hear something that is mis or disinformation, be able to share those factual information with them when they bring that up. And then the other thing is to debunk incorrect information. And that again is with messages that reflect the worldwide view and affirm, what the value of the is to the intended audience. And this is too where we were just talking about having those vaccine ambassadors or trusted people to talk with your residents about vaccines come in handy. So I'm going to turn it back over to Kristen to talk about current vaccine recommendations.
Yes, so we will take a look at the vaccine recommendations for influenza, pneumococcal, and COVID-19. Kicking off with the following table indicates appropriate vaccination of influenza for the inactivated, recombinant, and attenuated, all of which are recommended 1 dose annually. And this next table indicates the appropriate vaccination of the pneumococcal vaccine, 1 dose. And this chart shows the 3 types of the COVID-19 vaccines available and when the most appropriate dosing schedule is. We will break these out on the following slides. So these are the mRNA vaccines. We have our known Moderna, Pfizer, which are BioNTech, and these are both 2 initial doses and can receive booster doses thereafter. This is the protein subunit vaccine Novavax. And this is the adenovirus vector vaccine Janssen. This is the single loading dose, our J&J one. And here we have the COVID-19 vaccines licensed and available in the US by the CDC, Moderna, Pfizer, BioNTech, and Johnson & Johnson or J&J Janssen, and the FDA approved vaccines, again, listing the generic names with beside each of those as well. So we would like to ask you guys, if in the chat or verbally, you can unmute yourself. What, if you have any, do you have a process in place to verify the vaccination status for newly admitted residents? And what does that look like?
I see some response coming into the chat. So we have, they always check MICR, which is the Michigan Care Improvement Registry for our residents. We see that a couple times. It looks like we verify vaccination status pre-admission. We use MIC, which that's the Minnesota registry, and request records as needed. Yes, we verify via a combination of medical record review and Wisconsin immunization registry data. So lots of the immunization registries in all 3 of our states. That's great. Verify via MICR. We use WER. Yeah, great. Looks like those immunization registries are getting a lot of use, I'm sure, over the past couple of years, especially.
Yes.
Question. This is Kim. In regards to the audience and MICR or whatever it is that you use in your state, is your electronic health record, whether you use, I'm only really familiar with Point Click Care, but I know there are other platforms out there. Is MICR tied into, is not the word I'm looking for, but that's all I can think of, but can you access MICR through your electronic health record? Is that where you're going, or do you literally have 2 different sites, or are the 2 communicating with each other? We cannot. I got one.
Use 2 sites.
We now use ECS and it doesn't communicate with WI. Okay.
Does anyone have it so that their EHR communicates with their state immunization registry? I'm seeing a lot of no's. But
Yeah,
does
me too.
anyone
I'm
have
seeing
one?
that. You vetted and approved to access. That would be awesome dreams. That's what I was thinking too, Stacy.
And Jody, just to check, when you say you have to be vetted and approved to access, are you talking about vetted and approved just to access the state immunization registry? Or are you saying that your EHR does? Okay. Yes, to that first part. Okay. Just wanted to check. So it doesn't sound like anyone has an EHR that does communicate with their state immunization registry, which is a bummer. It sounds like that would make your lives a lot easier.
Yeah, because now you're probably duplicating your efforts, right? You're putting the information in MICR or what have you. And then I worked with Point Click Care, so you're putting all the immunization in there too, so that you can generate your reports. Yep. Double duty. Yep. Okay. Huh. would this be a possibility? I don't know, but you got my mind spinning wheels here, Mitchell, on what kind of possibilities your QIO can do to make something of that happen, or how to access or what have you. Infant stage in my thinking process here.
All right, and so on our last slide for this section here, these are just some of the COVID-19 vaccines available outside the US. You see some of the familiar ones offered within: the Moderna, Pfizer, Johnson & Johnson. You know, we've probably heard the name AstraZeneca and Covaxin, and along with the others listed there. And next, I will turn it back over to Jerry.
Thanks, Kristen. And I'm just going to talk through mention a few different tools and resources that we have available from Superior Health. First, I don't know how many of you, and you can just put it yes or no in chat, if you've actually seen or used it's called the Influenza and Pneumococcal Immunization Toolkit. And the link is in the slides, so you'll be able to click on it and go to it once you get when you click on that link for the slides. And in addition to influenza and pneumococcal, we do have information on COVID on here. And I'm just going to kind of scroll through here a little bit. So hopefully I won't make people too dizzy, but table of contents, as you can see here, it's the introduction, and it goes through how you can actually put together a vaccine campaign in your different facilities, how to make those recommendations. You know, we went through a few strategies, but there's a few more that are listed in here in our toolkit, talking about patient education and self-management, and then some of the different forms that you can share, you know, for vaccine information statements, talks about vaccine myths, also about vaccines for adults and being the trusted source for patients. And then we've also got information on billing, and then just some at the very end, sample letters that you can use to communicate with different caregivers that may be part of the care team for your residents. So as you can see here, this is just information that talks about the different vaccines in it. We've got facts in here, and this was updated a few months ago, so we realized things change, but was updated with the latest information. I want to say it was probably about 3 months ago. Elena, correct me if I'm wrong. I can't quite remember when we did it, but
That seems about right.
Yeah, it's fairly new information. I know there's not a lot of new information out on the influenza vaccines, partially because in the 2021 season and the 2021-22 season, you know, we saw such a decrease actually in influenza cases. Mostly we're thinking because people weren't out and about as much, but they were also masking and using, you know, good social distancing and those things. So, and then here, as I said, we just got different facts. Here we have a table on how to put together an influenza campaign. So these are good resources, and the resources, excuse me, with a number of different active links within these tables. How to educate your staff and residents. Also, the sample letters, I think, are probably some of the nicest things in here too, because it just helps you not have to, you know, figure out what to put in your letter. So it just talks about that. And then here's different ways to talk with your residents and their families. So we've got some examples from motivational interviewing, for using the open-ended questions, affirming, reflective listening, and summarizing method. Also here we talk more about some things that we mentioned today too, but how you coordinate care, how you use standing orders. We've got links to all the staff, or to all the registries for Michigan, Minnesota, and Wisconsin. Treating adverse reactions, and then the screening questionnaires also. Patient education, again, we've got the different links for the vaccine information statements are on here. We talk a little bit more about vaccine myths, and this is the presentation. There's a link to the presentation from IAC on there. Again, talking about the information, the schedule for vaccines for adults, And then we've got a resource developed by Superior Health on trusted sources of information for patients. And then this is information on billing that comes in handy. And then here's the different letters at the very end. So if you haven't seen that already, it's a great resource to take a look at and use. Also, we have links to the motivational interviewing strategies for vaccine readiness, again, and that was a presentation that we have done earlier this year for this series of webinars. And then we also have quality measure tips for both the influenza vaccine and the pneumococcal vaccine, and those are for both long and short stay residents. And then we have a number of other resources. This is a CDC resource. It's actually success stories from nursing homes and assisted livings, and we're going to talk more about that in a future session, but just wanted to put that out there, a great link that you can look at. There is actual CDC put this together, and there is a success story from Minnesota on there, one of the 3 states on the call today. And then just some more resources from CDC. Many of these probably look familiar. We've shared them in previous sessions. And with that, that wraps up our presentation of our main information for right now. And I am going to now turn it over to Elena to facilitate our Q&A.
Thanks so much, Jerry. Yeah, I was popping some of those resources that Jerry was mentioning right into the chat. The other thing I just want to mention really quickly, if you want to find those resources again, you can go onto our Superior Health website. Then you have to make a couple extra clicks. But if you click on initiatives and then Quality and Innovation Network, and over on the left-hand side of that page, get to nursing home quality, which brings you to the page that I will put in the chat. Once you get to this, you'll find a great deal of resources. It includes our Frontline Forces series. You'll find all of those right there. And then you'll find a bunch of resources from all different areas that apply to your setting. So they're all nursing home focused. So definitely check that out if you haven't already. I posted that link in the chat right there. You'll find a ton of different nursing home focused resources. So one thing I just want to ask everybody, something that we just kind of started noticing as we're looking at data from previous flu seasons, especially, we noticed that across our region of the 3 states, Michigan, Minnesota, and Wisconsin, that influenza rates among long stay residents has across the board gone down a few percentage points. So I just kind of wonder, did you notice that within your facility that compared from the 2020 to 2021 flu season compared to the 2021 to 2022 season, so earlier this year and the end of last year, did you see less people getting the influenza vaccination? Did we notice any trends like that? You could pop your answer into the chat and we can talk a little bit more about it. And you can always feel free to unmute if you want to speak more about that.
Good afternoon, everyone. Kevin Larson here. And yes, we did see those numbers, participation numbers decline last year. I think it's just the whole vaccine mentality of, I don't want to get vaccines.
Yeah, so it's kind of, it bled into influenza from the COVID hesitancy.
Absolutely, it did.
I'm sure that that is one of the things that we will hear from many people. I don't know, did anyone else see something similar? I see Jamie put in the chat, flu vaccine acceptance stayed the same for residents, but decreased for staff. Angie says, yes, our residents remained fairly stable, but more so with our staff. There's a lot of vaccine fatigue and hesitancy. We anticipate a greater decline this year, unfortunately. I guess in that, just thinking about this, oh, Stacy said, decrease in influenza vaccines for employees and contract staff. So we're really seeing it among staff members, it sounds like, but we definitely saw based on the data that it was with residents as well. I think the one state that maybe didn't see as much of a decline was Minnesota, but both Michigan and Wisconsin did definitely see a slight decline there among their long-term stay residents. I'm glad to hear that there isn't too much of a change, it sounds like, across the few people that have commented on this among your residents. Obviously, it's concerning among staff because I think we probably see this pretty often in the work that our team does when we look at COVID vaccination rates and booster rates. That staff number is often pretty low or much lower than the resident rate as well. Are you seeing that as well, that your residents are more likely to get vaccinated and boosted? I know the vaccine is mandated, but let's look at the booster then. Are your residents more likely to get boosted over your staff members? Maybe that's a pretty obvious one. I think we see that when we look at the data, that's just kind of what the data is telling us right now. So keeping that in mind as we enter potentially another booster season, where we're entering kind of 5 months after some of your residents may have gotten their second booster, and we're entering influenza season, what types of things, like I know Jerry showed off some of those strategies, what types of things are you trying to get ahead of right now to maybe encourage some people to get either this booster? Hopefully we'll have an Omicron specific booster out to us soon, and then the flu vaccine as well. Thanks for showing those, Jerry. Or are you doing anything outside of these strategies that you'd be willing to share with everyone else that you think is going to be impactful?
This is Kevin again. And the only thing I would add is we're just trying to do the, if you would, the subliminal messaging with posters around the building, even in the employee restrooms, wherever.
Yeah.
So about the only thing we can do, because it's almost, it becomes more resistive the more you try. So it's like you feel like you're making the situation worse than helping it. So that's the only strategy we're really using, is the posters and things like that. You know, any areas we can there, but that's about it.
Thanks, Kevin. And I think somebody mentioned it already in the chat that people have vaccine fatigue, right? And I'm sure we all do too, right? We have been talking about this for a long, long time with residents, staff members, family members, etc. Just it's kind of all consuming. So it's tough all around. There are people that don't want to listen anymore, and it's frustrating when you're the person that's always talking about it. So we hear you with that, absolutely. And I think that is a good strategy, just to make sure that people are reminded that flu season is coming up and that the flu vaccine will be available. But kind of in that same realm, is there anything that the Superior Health team could create for you guys in terms of resources, or a webinar that we could try to host that focused on something that you think would help, whether it be something that you could post on a bulletin board that might encourage a staff member to get the flu vaccine or the COVID booster that's coming soon, or residents, etc. Anything that you are looking for that you don't know if it's out there yet, that we could either find for you or create. one other document that I'm going to put in the chat. And I think we showed this maybe now almost a couple months ago, but this one might be helpful because what I'm hearing when I speak with nursing homes over the phone is that you have a lot of staff members, especially who got the primary vaccination series when it was mandated, but now that it's time for boosters, they're pretty hesitant because they got COVID in that time. So it's difficult to have those conversations with those staff members. And this is something that we created to kind of answer some of those questions. So it mentions, I've already had 2 doses of the vaccine. I don't think I need any more. And it kind of gives you a response to that. A number of residents who are fully vaccinated, some with boosters, got COVID-19. Therefore, the booster does not help. And it kind of gives you an answer for that. So that could be a helpful one, whether it's something that you use personally or it's something that you send out to residents, resident family members, staff members, etc. That could be a really helpful resource. It also shows a nice infographic in one of the links within that document that kind of shows some of the effects of COVID-19. So who gets it and who unfortunately passes away from COVID-19. So that one could be a good resource to show. But in that same area, are there any other resources like this that you could use? Angie mentions, what are others doing to offer the new PCV20 vaccines, so those new pneumo vaccines, as this seems to be one more vaccine that will add to the fatigue. Does anyone have any suggestions on that or what you're doing with your pneumo vaccines? Similarly, across all 3 states, we saw a decrease in pneumococcal vaccination as well. I don't know if people saw that in their facilities, but I assume it's just exactly what you're saying, Angie, something that added to the fatigue.
Has anyone had any luck maybe involving their medical director or the resident's primary care physician or their trusted practitioner that goes in to see the resident? So I don't know, you know how everybody has their person or their trusted individual, medical individual. It might not be the floor nurse passing medications. It might not be the DON, but maybe it is. Maybe it's their primary care physician or their medical director that needs to do some one-on-one visits with their residents to get that influenza or pneumococcal vaccination on board. Don't know if it'll work, just a suggestion.
And Mitchell made a really great point in the chat. So he says, we use the PCV20 to help. It only takes 1 vaccine. I feel like that is one of my selling points. Vicki, thank you. You have excellent acceptance of the pneumococcal vaccinations. Any secret sauce there? Anything that you think makes a difference, or do you just have a pretty open-minded residents who are concerned about pneumococcal illnesses and want to get it? The residents want to stay well. Thank you, Vicki. That's the dream right there, I would say.
And you're right, but like, where does that come from, right? How did the residents in Vicki's nursing home get that message? I'm just digging a little bit further here, Vicki. Is it, is your infection preventionist going out and giving them all the information? Are you bringing this up in all of the care conferences, resident council? The pharmacists, medical directors? I mean, you're right. I agree 100% that I love your residents want to stay well, but how did they get to that point? Is there anything, a couple of things that you feel may have contributed to that success?
That could definitely be a part of it there, Vicki. You go directly to each resident and discuss the vaccinations with them. Jody says,
There we
as
go.
the IP, I pull the records and address any missing vaccines with them. Most accept the vaccine, very few decline. And this is kind of leading into one of our the call that we're going to have in 2 weeks, but kind of going off some of these. When you go in to discuss vaccinations with residents or staff, especially residents probably in this specific situation, do you kind of ask them, like, would you like the vaccine, or do you use a different strategy with introducing the vaccines when they are due? What does that look like when you enter a room of a resident who's eligible for any of the 3 big vaccines there? We got influenza, pneumococcal, and COVID. And if you can't think of that right now, I'd encourage you to kind of think about it over the next couple of weeks, and we'll talk about it more 2 weeks from today. But Jody mentions, I let them know I see they are missing a recommended vaccine. I automatically take the VIS sheets with me and just have a discussion. Great. Does anyone else do something similar to that? Or different? I start with informing the resident that it is recommended and address any questions or concerns. Does anyone have any super common questions that you see when you make these recommendations that you've come up with a really good answer to, that's easy to digest? Angie, we have always framed our informational letters to residents/families regarding flu shots. If you do not wish to be vaccinated, please let us know. Otherwise, we will be arriving on whatever date to administer the vaccine. I think that's a really great strategy. Kind of more of, seems a little bit more like an opt-out, because sometimes when it's more of that opt-in situation, it might lead them to believe that there's uncertainty among their care team that they should or should not get the vaccine. I will always start by reviewing vaccination history and look at their general vaccination history. If it looks like they have been vaccine hesitant in the past, I prepare myself accordingly. Yeah, you might have to give yourself a pep talk before you walk into that room and make recommendations.
You know, I always use the reverse psychology. I always say there's like a limited supply, so you might want to get yours right away. And
there you go. I mean, with the COVID vaccine last December, that was probably pretty
right?
true there, huh? Yeah. That's a good one too. These are, I mean, in our world, probably those of us who are giving them, these are things that we want to get. And so you're making them, you know, feel that they want to be one of the people that get it. So. Any other comments or thoughts or anything? Questions? Does anyone else have a comment on what you're doing to offer the new PCV 20 vaccines? I want to go back to Angie's question because I know we got one response on that. And Angie, have you started to offer that one yet? And you've kind of seen some hesitancy, or are you just kind of in anticipation of that? No, our plan was to combine the administration with our annual flu shots, more just anticipating some concerns. Great idea to do some co-administration. It's definitely a-okay to do that. And it's honestly, it's very, it's a best practice there to just kind of get it all done in one swoop. We could find some resources on that. And I think we'll be talking about that again at a future call once flu season is in effect. But I think what Mitchell mentioned earlier, with it being just the one dose, that could be one of the ways to talk about it. So definitely encourage that. And we'd love to hear some feedback on how that works for you once you start that process. But yeah, I can only imagine just the anticipation once we get to flu season, and you're also giving the pneumococcal vaccination, and there's lots of hesitancy and concerns about the COVID vaccine, and it's just a really difficult thing to tackle. And if there are things that resources or other things that our team could kind of help you with, that's what we're here for. So I just really encourage you to let us know on this call, to email one of our team members with something that would be helpful, and we'd be happy to let you, or we would be happy to find something or create something helpful for you. One other thing that I'll mention as we enter flu season and potential next rounds of boosters is that our team can help you set up mobile vaccination clinics. So I know lots of people are struggling with staffing. You just have so many competing priorities. So if you ever need assistance with setting up a mobile vaccination unit, that is something that we can connect you to, where they come out to your facility and they assist with that process. So if that's ever anything that's of interest to you, please let us know on this call, or you can always reach out to someone on our team. But with that, I will hand it back over to the main team unless there are any other questions.
All right. Well, thanks, Elena, so much for facilitating the discussion. And thank you to everyone for the great engagement in the chat. I always really enjoy these robust conversations, and we couldn't do it without you. So thank you for sharing. As you know, we have started to throw our upcoming sessions onto the end of our PowerPoint presentations, just so that you know what's kind of coming up. And hopefully this sort of helps you plan and you don't just come into our calls each week surprised to see what's happening. So these are our next 3 weeks of sessions. As I mentioned at the top, today's is part 1 of our 3-part immunization series. So over the next 2 weeks, we'll be digging more into part 2 and part 3. And then our session September 14th will be the last session in Dr. Buffy's 5-part series. So we're excited to welcome her back for that last and final session in her webinar set. So with that, I have put the link both to the event evaluation as well as to the slides for today. So if you can take a minute before you log off, just to make sure you grab a copy of the slides, as well as to provide any feedback you have, we would really appreciate it. And with that, Jerry, anything else you'd like to add before I close us out today?
I don't have anything else unless Kristen does. I just want to thank you all for joining us today, and hopefully some of the resources we've shared and some of the strategies and information that we've shared about why it's important to vaccinate those in your facilities, especially those with chronic conditions, is helpful to you. And as Kelsey mentioned, if you do have any questions, certainly reach out to any of us on the team. I think with that, we can close out for today. And again, thank you all for attending, and we'll see you again next week.
Take care, everyone.
Thanks, everyone.